Good afternoon, everyone, and thanks for choosing Across the Fence. I'm Will Michael in this afternoon for Judy Simpson. Today we feature another segment of our ongoing series with the Vermont Cancer Center of the University of Vermont and Fletcher Allen Healthcare. I first met today's guest a couple of months ago. She was with us for an insightful program when we discussed cancer and the brain. And so we've asked her to be back with us today to discuss some of her research on memory and aging in women in particular. So I want to welcome back Julie Dumas. Julie is a member of the Vermont Cancer Center, and she's an associate professor of psychiatry at the University of Vermont's College of Medicine. And on the research side, Julie, you're the associate director of the psychiatry department's Clinical Neuroscience Research Unit. And again, thanks very much for being with us. It was a great discussion a couple of months ago. And in the introduction, I broadly referred to some of your research. Sure. Specifically, you're into some pretty key issues, menopause, aging, cancer, chemotherapy, and how these things affect memory, particularly in women. So let's start broadly. Tell the audience, our viewers, a little bit about your research, Julie.
Right. Well, thanks for having me back. So the thing that sort of weaves together all of these big topics that you mentioned is memory, or the interesting thing for me is memory. So I started off studying memory a number of years ago and sort of thinking that, you know, it's really fascinating that I can remember my elementary school teachers or what I had for lunch yesterday or some math problems you learned in high school, and sort of understanding how we're able to do that, then how we are able to use that information to guide our future behavior is really fascinating. And throughout my work, I sort of, for a number of reasons, got into trying to understand memory by understanding how it goes wrong. So in terms of aging, we all have experienced things that aren't as good as they used to be when we were 20. Or another big change in particular for women is menopause. So at menopause, all of our hormones sort of change from how they were when we were younger, and this affects our cognition. So all these, this is how memory is the thing that sort of weaves all of these things together that is really interesting for me.
So we're going to talk about a lot of those issues, but maybe we could just point out from the beginning, somebody who's watching who's saying, gee, I forget where I leave my car keys, or where's my purse. As I often refer to those, and we hear on this program, that's a normal part of aging.
Absolutely.
So what is, when you say sort of the negative pieces, can you just quickly describe sort of what are the non-negatives? What are some things that we would expect to occur as we age?
Right. So as we age, we all may forget names, or some people were never good with names to begin with. We all may forget what we go into a room and we forgot why we went there. And those are sort of things, everyday kind of memory mishaps that happen to people, and those are normal things. When it crosses the line is when other people start to notice these difficulties. So that's when it crosses the line, and that's not what my research talks about, and I'm sort of working a little bit before that. So we can understand some of these changes that happen earlier in middle age. Maybe we can prevent some of these more drastic things that happen in older age. So that's where my work is focusing, is their middle age difficulties, or changes in memory, I should say.
And one of the, as I said, you've already said it, one of the key pieces is menopause, and you brought a very interesting graphic that our director Roger Lewis can put up. Tell the viewers what we're looking at and why this is so important.
Right. So what this graph tells us about is on the bottom there, you can see years. And in the last 100 years, the life expectancy for women in particular has gone from about age 50 to age 80. So that's a 30-year increase in life expectancy for women in the last 100 years. And generally, the menopause occurs around the age of 50. So women are living approximately a third of their lifetimes in this different sort of hormonal environment. And that sort of justifies studying it, or trying to understand what does this hormone change at age 50, how does that influence the next 30 years of a woman's life? And that's where my research comes in, trying to understand how we can make those 30 years, improve the quality of life of the final 30, it sounds terrible, the next 30 years of life.
But the point, and the point of the graph was also showing that this is a relatively new phenomenon. This has only been happening to a generation of women, say born 19, 20, or 30 and beyond, because they're the ones now living that long.
Exactly. So we're living those years, and now the research is a little bit maybe behind the times here. So we're trying our best to catch up, sort of understand how we can make that successful aging.
So do we have a baseline, an elemental understanding now of how menopause affects memory?
I think so, and I think the unfortunate message is that it depends. So menopause, as people may be familiar with, is a change in the sort of the hormone change around age 50 when the ovaries stop making estrogen. So and this change happens over a few years. It's not instantaneous unless some women have surgery and it becomes instantaneous. So it happens over a few years, and during those years, there's sort of this kind of rocky change. So women may have increased hot flashes, which are sort of distressing. They may get less sleep, and all of those things contribute to the memory difficulties, which also may be in the background as well. So again, these general memory problems like forgetting people's names, or maybe having to write things down at work more than you used to have to do 10 years ago, or forgetting what you went to the store for, those sorts of things may increase around this time period. But also, as I mentioned, as hot flashes increase and sleep decreases, those things could impair memory as well. So we try to maybe take medications or do some exercising or things that sort of can get better sleep to make those things better, and then we'll try to see what's left over with the memory impairments if they do exist.
The topic of hormone replacement, that's not a new topic.
Nope.
But is there new research? This is something that we continue, the medical and scientific community continues to look at?
Exactly. So we, in terms of, as my focus is on memory, no physician will prescribe hormone replacement therapy for memory impairment. So that's sort of, I think that story is, I'm not sure it's solved right now, but for right now, the risks of hormone therapy in women who are over 50 are greater than the improvements you might see from some on memory tests. However, that's on average for every woman. However, it depends. So our research has shown that sometimes hormone therapy does improve memory performance. And our research is a little bit convoluted. So we are creating a model of memory impairment, and we're showing that estrogen can improve it. So it's sort of I guess it depends, and we're trying to find out what it depends on. What are these factors that are sort of underlying these benefits that we can see from some hormone replacement? And
just the layman in me says that would all make sense.
Right.
These various tests, the things that you can do, and that's why the research is important. Now, you began to refer to a model, and if I'm not mistaken, that's we have a couple of scientific slides that may come back to back here that tell us what this is.
Let me tell you what this is. So this is a picture of the brain. It's just 3 different views of the same brain, and you can see there are some orange colors on the brain. What we've shown here is this is a slide of our research study where we give, in addition to the hormone story, we're trying to understand the chemicals in the brain that are affected by hormones. One chemical is called acetylcholine, and this slide shows us when we use a medication to block acetylcholine, we have these increased frontal activation. So where you can see those orange colors in sort of the front of the brain on the picture on the left-hand side, it's the orange on the left. That's showing us that when you give this medication to block acetylcholine, we have increased frontal activation. And that's the same as if I were to take a group of people over 60 and a group of people about age 20, we get that same orange color. So older adults have increased frontal activation, and we can show it temporarily. These drugs are only temporary. They work for about 2 hours. We can increase this frontal activation in women after menopause. So this we call a model of aging that is temporary. It goes away after 2 hours. And what we show is when we have estrogen treatment, so if we have given women estrogen for 3 months beforehand, you can see that the frontal color is now blue. And what that means is that there's a decrease in activation here. So before estrogen, we have this increased activation looking like an older brain. And after estrogen, we have this decreased activation looking like a younger brain again. So this is a somewhat complicated or complex story. It's it's not sort of you don't do this walking down the street, but it's sort of understanding the mechanism underlying how estrogen is working in the brain. And we know it's not right for everybody. And this is our attempt to sort of understand maybe people who are having this increased aging, it might work for them. But again, the side effects make it difficult to sort it all out.
I want to ask directly in the slides and the way that it was described, are we saying that estrogen does, or that it appears, or what are we saying about what it appears to do in terms of reversing aging?
So it decreases the frontal activation is the sort of the technical term, and there are a number of studies showing that older adults have this increased frontal activation. So what it didn't do is it didn't make people better, they didn't perform better, we just made their brains look different. And so how that is all connected is it's a big story that we're working on, and a number of other people are working on as well, how these nice colors on my nice slides relate to performance on memory performance. We're still trying to work that out.
Okay. Now there's a couple of other aspects of your research that I do want to get to.
Sure.
One of them, and I need to refer to my notes here, subjective cognitive decline. I know that's a fancy term that you can turn into English.
Right.
What does that mean to our viewers?
So that just means that you, and anyone, not just women, might feel that your memory isn't as good as it used to be. So maybe if I think of myself now compared to how I was 10 years ago, my subjective feeling is that it's not that great. The critical piece about subjective cognitive decline is that you do not perform poorly. So here we are again with this sort of, it's your personal assessment, however your actual performance is not impaired, and that's the critical piece. And the reason it's critical is there have been studies by other researchers showing that some older adults with the subjective cognitive decline are more likely to convert to Alzheimer's disease than older adults without decline. Let me just qualify. That doesn't mean that if you don't think you're as good as you were 10 years ago, you're going to get Alzheimer's disease. It means that it means we're trying to figure it out. And these studies were in people who were over 70, so they're a good bit older than my research. But we're trying to understand sort of what does just a simple assessment, I'm not as good as I used to be. How does that relate to our brain functioning? And I have another slide here showing you that we can actually, you'll recall that this orange thing on the left side is increased. It means you are looking like an older group. When we compare our subjective cognitive complaint group to the women with no complaints, there's this increased frontal activation. So we're making the brain, these people with this cognitive complaint look, quote unquote, look older. Again, what does it mean? What can we do? We're still figuring all of that out.
Yeah, you're in the process of this research right now.
Exactly.
So we'll get you to commit right now to come back once again.
Sure, when we find the answers, right?
But as I said at the beginning, we first met you in conjunction with cancer and the brain.
Exactly.
So some of these things that we've been talking about, do they relate to your research on cancer and the brain?
Yes, interestingly, they all do. So specifically, we're talking about the subjective cognitive decline. We see that in people who have cancer and have cancer treatment. So we're assessing this cognitive complaint in people after their cancer therapy. We're doing a research study at the University of Vermont with Dr. Kim Dittis, where we ask people to come into the lab before, women with breast cancer before they have their chemotherapy, a month after they're finished with chemotherapy, and then a year after that. And at each of these time points, we assess them. What do you think about your cognitive abilities? How is your memory now compared to before cancer or before menopause? And we get this big questionnaire, and we assess their cognitive abilities. And what we see in this study, and so we're still analyzing the data, we're not completely done, we see that in terms of memory performance, how they perform on tests, there might be some decreases 1 month after chemotherapy, and these return back to normal a year later. What doesn't return is the cognitive complaints. So women, a year after cancer therapy, they still think, I'm just not as good as I used to be. However, their performance is just fine. So that's an interesting piece. So there's now this distinction between how people are performing and what they think they're doing. And again, trying to understand how that all plays out. It will be interesting to follow these women 5 years from now and see sort of maybe, I'm back to normal, or no, I'm not. And so what does that mean?
Or they are, but don't think that they are.
Right, exactly. And they are at 1 year. And actually they're always normal. They're just sort of different from what they used to be. But they, in terms of what they think, how does that affect or influence what's going on in the brain?
Julie, we have just about 1 minute left, and I guess in that time, could you briefly touch on, for women who are not undergoing cancer treatment, for those who feel that their memory right now is pretty good, what are briefly, what are things they need to keep an eye on?
As we said, it's other people noticing is the big thing. So is your partner saying, you know what, you're not remembering what we talked about the other day? That's a big that's a line that we're concerned with. You should probably get some help from your physician. That's really the big thing. And
I apologize because I need to jump in. We do have a website for you at the university, and that key website, uvm.edu/medicine/CNRU. That's ways that folks can learn more about your research and some of the things that you have coming out even in the next couple of months.
Absolutely. Thank you. Yep.
Thank you, Julie, for being with us. That is our program for today. We know you have choices, so thanks for choosing us. I'm Will Michael, inviting you to join us back here each weekday afternoon for another visit Across the Fence.